academic inquiry, and pressing realities of human condition. I'll say a few before I conclude. Dr. Deka and our founder Chancellor Dr. Shanmugasundaram. And Dr. Deka is popularly known as cochlear implantation. He was the pioneer in India and who implantation was after trained in USA and trained. Popular is a very action administrator. He was former director of India Institute of Medical Science, Delhi. Incidentally, he was happened to be the chairman of the UGC committee who visited to assess our academic performance of our Vinayaka Mission Research Foundation deemed university in 2019. Had an opportunity to interact with me a little closer, and we traveled together to Pondicherry. And other than academic and professional expertise, what attracted me being his very, very humble, down to earth, and he actually was about the top 50 honest persons in India. Top 50 honest in India is not an easy thing. Become honest in all levels. Intellectual honesty, financial honesty, admitting all the easy to say but difficult, very, very. He has been awarded once recovery is required only the competence. Be humble. That is the point of the day, our competency and skill. We are key with Dr. Deka, who delivered this founder Chancellor Oration today. And it will be quite unfair if I mention Dr. Shanmugasundaram on this occasion. A man with great courage and great eyes in established institutes. The operation has grown to 4 locations in Milwaukee, Salem, Karaikal, and colleges, 4,000 support and administrative staff. The institute has grown from 1982 till now, including by HR. We believe the person who started college, that time it was 2010. 1995 in Karaikal, 97, Karaikal, very faculty, medical college 97. First private medical college is in Pondicherry. Jipmer was on those days. Next present in India. So at least 4 colleges we have been also engineering, nursing, first aid, since homeopathy, law, considering 100th program including 50 PhD. During action, he taught me few things which are very valuable. You cannot sail the boat or all the tides are the first advice in me. You have to swim against the tides. So you have to sail the boat against the tides. Expect every time we settle, we sail your boat. Time is friend. Time is the most important enemy. Too short, whatever you want to do it. So don't wait, don't delay your action plan. And third thing is communication. Experience and expertise administration will teach you. And that's what I have made. So the more he was successful. So I remember on those days for working with him and the newer challenges, new ventures. So in this mission, we are today on of technology and its useful outcomes, the use of technology in health outcomes. I urge you to listen this oration not as a piece of information but as an inspiration. Thank you very much.
Thank you, sir. Today's oration academician means education, national and international recognition. Now invite Professor Dr. Deepthi Shastri, Dean, Faculty of Medicine, VMRF, who is the distinguished orator, and read the citation.
Honorable President, VMRF, the respected orator, Dr. Ramesh Chandra, distinguished dignitaries on and off dais, esteemed guests, and I deem it a great privilege the session for H and the Rounder Station 2020 to Dr. Ramesh Deka, distinguished advisor, Royal School of Medical and Alliances, Royal Global University Guwahati, and former director today. His oration is on TKM. Vinayaka is to be university for H and found Chancellor Endowment Oration on Professor and eminent visionary distinguished researcher of India, respected medical years. Professor completed his MBS from Guwahati Medical College and MSc from the India Institute of Science, Delhi. A remarkable year spanning clinical practice, research, teaching, and institutional leadership, he has made pioneering collaborations in establishing and answering clear emphasis and hearing rehabilitation programs. As international Deka has substantial neuro and head and neck surgery, numerous scientific publications, academic mentorship. His dedication to advancement of individuals suffering from communications. Deka has distinction as head PhD, Dean, and subsequent director of MC. Among his commercial of science and technology, FIMSA honorary scholar recognition among 100 most trusted people in India by Reader's Digest. He has received recognition of his outstanding contributions in research education service. Currently, as a distinguished professor of medical science, Royal Global University, Guwahati, Professor Eka continues to inspire generations of healthcare professionals through his scholarship, leadership, and persistent commitment to advancing medical science with pioneering and lifelong dedication to care, education, and research. Vinayaka Mission's Research Foundation deemed cities to present Dr. H. Mukhammed exceptional student in education. This is awarded in the presence of the President, Vice Chancellor, members of the Executive Council, faculty, researchers, and students of Vinayaka Mission's Research Foundation deemed to be university today, the 29th of June, 2026. Thank you.
Dignitaries to occupy this of the dais. It is now my great honor to invite our distinguished orator, Professor Dr. Chandra Endowment Oration, deliver the Dr. Shanmugasundaram, Founder Chancellor Endowment Oration 2026 on the topic Safe Practice of Sustainable Knowledge in Health for Quality Outcome.
This is the pointer. Okay. Good morning, ladies and gentlemen. It is indeed a great honor for me to accept this award and thank you to consider me for this celebration. Today morning, we have met the very distinguished son of BME educator, the current chairman and president, thereafter all our teachers in the institution, including even P.K. Sudhir, the present vice chancellor. Indeed, for me to see in a place like Salem, a leader of higher education, seeing a laboratory school, and thought that he has to do something different from laboratory technology. Medical education and continued by very esteemed and able sons and said by management institution in success. This place about to university at the time after PN 10 2008 and deemed to be universities were not reviewed for full continuation of their power to get to vision to exams by exposition, cooperation, and scholar and great interaction of student and found and number has been proved to potential of time while you can see various technologies which were about 30-40 back. Nowadays we are fully dependent on technologies to diagnosis and effective diagnosis and space diagnosis. Our job as a professional has become easier to practice our medicine using those technologies, this level of diagnosis, and then appropriate treatment. And today, when the public at large, I believe, with the services of internet available to us, most people, even public educated people, can use internet and find the disease condition, science behind disease condition, and the available therapy worldwide. So it becomes easier sometime when a patient comes to us as a doctor or a other level of physician, patient or relative, they come with quite significant amount of knowledge about the disease. So it becomes challenging because patients are knowledgeable. Although they are anxious, they are knowledgeable. Therefore, we have to create in ourselves, update ourselves, those who are not convergent with certain knowledge and available technology earlier, they need to be trained as a capacity building activities, which most of the universities are doing. We are set position in diagnosis or treatment does not produce any harm to patient. So I'll come to that. Can you the next slide, please? Next. As a health professional, I have to tell you, mainly for the students and younger colleagues, that very important disease. Number one, you can see is relief symptom or relief to pain. All various disease conditions have different symptoms, different kind of patient. So I again show here. You can see here there are 6 quality improvement goal here and all other disease. So timely action is very, very important. Timely action, very treatment important for better outcome. Profit. Now, if as a therapy, including the diagnosis, there is intervention diagnosis, and you are welcome. If the patient is the number 2 or rather number 1, I should say, then number 2 is timely action. So there are 6 quality improvement. You can see quickly. I'll go to later on. Safety of the time, it should be patient-centric. And I don't depend or communicate, you have to dissuade the relatives. They are only then diagnosis of therapy and could delivered. You don't buy as any concrete or a politician or high low profile. So quality is to be kept in mind. That is one point. Number it's a very good question. Today only I have seen your honorable chief minister is given pulse polio doses to children. This one I want to mention, pulse polio program was so successful in India. We have eradicated polio. It's a very disabling disease, you can understand. But we need to sustain it activities for pulse polio activities to prevent further polio in other countries, particularly in so there is one to immunize. Various other we need to have right from the birth of baby, 5 years old and thereafter, prevent viral disease or bacterial where in which we have vaccines available. So that is one thing. You have seen in that correction. I should mention also how COVID epidemic worldwide was a short time because of the new knowledge available. I'll come to DNA, RNA, and find out the cause. Once you know the science, you have to produce vaccines against that. We did that worldwide. British scientists created 2 vaccines worldwide, including India, manufacture and supplied them time. That's a pathology and molecular level vaccine technology. When the antibiotic in 1945, we got newer antibiotics to contain and control various such disease conditions and bacterial infection, fungal infections do cause established negation are all helping to find appropriate molecules, and manufacture of various molecules has great India is a leader in supplying medicine, pharmacological molecule to various other countries, including Africa and so on and so forth. So, ladies and gentlemen, I am sure the foundation medical colleges in the board for teachers, recruit chancellor and vice chancellor and the committee who are involved in and the fire of bacterial that if you control pain and contain infectious disease. I'd like to mention here at the time of our independence, or somewhere 40 years, 20 years, we have taken Commonwealth countries get help to improve our health things. We started the legacy of British healthcare practice. In that sense, we did activities to prevent disease, control disease significantly. Only thing that we are having because of the increased longevity that we gave through disease, give it to them, vision of white and particularly there is a scheme, all know, dots preventive policies. Tuberculosis is a problem because there is a patient who spending level in reduced significantly because of lack of education. They don't practice medicine to prevent anti-tuberculosis. So that's program option. They are saying one point I have seen even in a center, but tuberculosis again unless it may or not control the do dice, but the medicine because of lack of lack of nutrition. I have seen myself. So, ladies and gentlemen, study longevity increase process to condition contain disease, and we have so improve overall quality health. Right that already has. Health mission to be in urban health mean to be done beside activities done by eminent people, leaders, Shanmugasundaram Institution, Gospel College. There is education school to higher education in Bangalore and another your Simon and primary education and higher education by Sundar now for and thing to know it's Sekanataka Salo generic also important for how can person to powerful is my mind or do studies and human able to communicate tradition efficient while it is available to them. How to use knowledge and practice 100,000 people die per in USA for medical error. Can you believe that? You may not believe. India, we do have data. It may be. Therefore, our professional put our head together collaboratively with the scientists, clinical scientists, clinician, clinical diagnosis, then scientists helping us to produce required knowledge. You can see from this slide, right from 1895, Röntgen's discovered X-rays. X-rays were done to begin with because of radiation effect, but they utilize and new model things and different model is 3. So even technology has greatly assisted medical profession in all the activities. You can see briefly I'm mentioning it. I'll not go to great details because this is not a classroom to teach the student, but to emphasize how we have progressed in imaging. You can see the imaging has greatly improved the quality in neurosciences. Neurosciences, again, intervention radiology. You have a very special hospital in BIMS I have seen. Surely specialty hospital is highly equipped and they are taking benefit of the imaging science that and technology that are available to us. Surely our chairman must have provided all the infrastructure required to do this kind of knowledge delivering access to the needy patient. You can see also the how ultrasound, one can, the ultrasound in fetal medicine. This is another area. Those who are in gynae or family medicine, they will appreciate how even after pregnancy, even to cut short, even pregnancy diagnosis. Previously, there was different. When you plan your family, one can be forced and monitor how the baby is growing inside the mother's womb. This one is coming as a specialty. One of my relatives is specializing in fetal medicine. You can see from fetus to geriatric medicine, therefore, we have now widened our responsibility to look after. That's the benefit of technology available to us. The health providers have to equip all those available tools. So, also we can see fetal anemia own drops. Like adult people have anemia, they require blood transfusion. But fetus, they have guided infused into the baby through umbilical mother's womb. Technology. And but has to be learned properly, training has to be given. Safety issues are there. If you don't do your safety issue properly, they may get infection and baby may die because of your intervention. So training is in technology, any intervention within abdomen or brain or anywhere or in the eye. I mentioned one thing so that I can cut. He was professor and head BNT. No, the technology has helped to control the cataract burden in the country. Small laser incision, 2 millimeter, you emulsify the lens. The science has improved stress. This is advantage. Do is foldable lens inside the eyeball. Can you believe that? Previously, they used to make a big incision, remove the cataract lens, and glass or third party. You can not only inside give a foldable lens after cataract emulsification, and it then less and after one RP Center in All India Institute of Medical Sciences, technologies. We'll go to next slide. This net polymerase paper can help early diagnosis. And today, Government of India has passed a abortion act. If you want to have that be, you can abort also. Next. Again, I am going back to this slide, although I have mentioned 6 improvement framework for the students, young colleagues, that you must keep it in mind for whole life. Number 1, patient safety harm to patient by the intended treatment or diagnosis that one is supposed to do. It isn't unless approved national disease controller general of or a very initially after clinical trial and research is very much in the form of stent you cannot put inside the human body. Once the only approved items must be treated, experiment, disease contagion, research with kind of a proposed project, approval petition, from the first different, but whenever a clinical medicine, when you offer treatment, it has to be with approved, national or internationally approved molecules. And if it has to be efficiently delivered, efficient services available from our health connectivity, various state to Panchayat, and we have seen it in COVID, we have done that. In 2006, when dengue epidemic occurs in Delhi and other places, how efficiently we deliver services and contain and control the disease. Hereafter, of course, vaccine and issues. In the no gender bias risk for so on and so forth, it is known. The parameters are very, very important. Next slide, please. I'll not go to great details of this patient safety. I have just kept it for half a second. This slide. The issue must keep building a safety in the hospital, in university clinic to keep in mind your activity. I'll go back. I mentioned about one of my friends having cataract operation. How he is a professor. He was there only Jipmar. I should mention because I work. It is a factual thing. I am not alleging them. The importance of hygiene and instrument sterilization and the drops that use after cataract surgery for its expiry date or the solution, eye drops, expiry date of any medicine is important for nursing student. But in this case, that Dr. Majumdar, third day he had pain, very big pain on the eye, and started suppurating. Can you believe? Bacterial infection. Because of the suppuration, whole eye is finished. Then opposite side, he was hesitating to do cataract surgery. You never know. Little patient is there. Therefore, I made him 2024 in Shillong. So he had difficulty to move, but with support, he gave a lecture also. And later on, he is about 6 months back, he died also. So that's the signal again. The simple thing like hygiene, simple thing like sterilization, simple thing even the all medicine you important organ like heart, liver, you have double when you deliver certain medical introduce any intervention in the form of stent and so on and so forth. Next slide, please. These are also important steps. Any access to equipped care facility, particularly if a patient is having stroke, the doctor who has seen first, you have to decide in a short time to the patient. It detects level inside the present intervention department in AIMS. I remember one of the had a as director at the time, Chancellor, and it took from 7 o'clock. They go inside into the brain and suck out the clot and so machine which thin is given also. These are the power of technology, intervention radiology, intervention neuroradiology, intervention radiology, even abdomen, if there's a bleeding or a stenting cord, that's the power of intervention radiology. I'm mentioned. So, next slide, please. Obvious points. A lot of cases occur. Legal plans relatives have a tendency to blame, or rightly so sometimes. Patient came standing, walking to the hospital, but after diagnosis and all that, you have put something, and after some time you said that we have to keep him in the ICU. No, which but maintain ICU and informing the patient about the condition of the patient is very important. And you have to keep in mind, ICU should be not only be to about the current state of the patient, but there is no misunderstanding, so that there is no legal issues if the patient expire. Many patients do expire once they go to ICU. It depends on the condition. Ladies and gentlemen, next slide, please. Next slide, next. I will not go to detail. Next. We have already discussed. Next slide. As you can see this slide, we are yet to build an international commitment that we made. 195 countries have met in UN to this 17 important goal. We are yet to achieve that. You can see here, no poverty. That is a very difficult question and question. It is early drive. Any light signal you will find out beggars. And these days very hot. People, they live at night also. Poverty is still there, country. There is no doubt. And possible action was said by Indira, and it was significantly successful. So it is still there. Zero hunger. People should not die of hunger. They are very linked. But for our case today, I'll put, say, number 3, health and quality. 17, collaboration. Today, you cannot analyze your process with one country build time or continue link with other countries. They are having MOU with research, very important collaboration in only they have research. I'll give a designation Dean Research, so that they have improved quality. At that time, we international for undertaking research in crores rupees. But I was told last convocation, they have got 200 crores rupees of research fund from abroad. Point to their and research of international worldwide population. Important. Next slide. So internalization is important for treatment able to any place in Harvard or UK, any Germany, Europe. I have visited several countries in the US, states in the US, including Harvard. My fellowship and learning continues. From granted here to do certain things. But while doing all those things, safety of the patient is again important. Mention, if you permit, one of the top institutions when I worked in 1978, I'll not name, they may feel bad, was one Sarvottam was the radiologist, another cardiac surgeon was Pitambar Satpati. Cardioplasty, angiography, then angioplasty. The relative of the Pai family, he said, I have got no but enough as a volunteer. Can you believe? When you take a volunteer, you have to take conscience as well as you have to see that your procedure doesn't kill the patient. While doing the angioplasty, there is some bleeding occurs in the heart, and the heart, as you can see, heart is a most pivotal organ to supply the blood to all parts of the body, including the brain, body. So they called Sarvottam Prabhu and Sajan Pitambar Sarpati. I was there as reader and head of ENT, and we are in the operation theatre at that time. Opportunity to revive. Therefore, for any intervention, card surgeon be standby. That is a key standard. But today, of course, most people who are trained in cardiology, lots of angiography and angioplasty, therefore, that surgery numbers have gone now. CABG is coming up because of the longevity following CABG. CABG means coronary artery graft. One example I can, Manmohan Singh had CABG around 80 or 81. Subsequently, our own product, Dr. Ramakant Panda, Asian Heart Institution in Mumbai, but he was a product of AIMS. He was having the maximum experience of revisions. We say analysis and can see that was when I was in, that was 2008. Manmohan Singh revision CABG. You can see in Manmohan Singh after revision CABG. It is also the rating. Education, medical seal, and now it has introduced. There is no doubt. Yep, they have made based curriculum. Even they have listed what competency to be required by an MBBS student in anatomy. Various others that were chairman at the time. University power to improve beyond minimum level by the medical council or NMC. So all teachers were here. I'll request you. You can do improvement of the council. Opportunity various check. More. We have great duties, tremendous duties, and effective, and to practice them effectively. Students are fully in cadaveric situation, not directly in the patient. Most once your surgical technique or say you need to do cadaveric dissection, even in my field or even any other field where surgery is simulation, minimally invasive surgery in the abdomen and gynecology, everything is available, but will have done. Once you learn and learn deals, therefore you want the psychomotor activities that you have to learn and acquire besides the cognitive knowledge. There is a beautiful things in boom of our development. Two psychology is also, that is called affective domain, emotional domain. It means in terms is the objective of one to expect the student to learn a course of the system to create kind of system, remember and recall. There's this only is called important is higher analyze data efficiency or data evaluation. Very important of patient history evaluate. You can student become professional thereafter how to deliver vaccination and life post treatment surgical treatment that benefit patient. Patient available to us nowadays. You can go to various countries and see this I have mentioned the taxonomy knowledge already. I don't want to mention more. Very important for teaching us to understand taxonomy is technology religion. This taxonomy is very good. We have next, please. First train in 71 till recently. This was built with a effort after the independence with the Commonwealth organization when they decided and the services in variances or next slide. I can see again back today started knowledge. All transplant must be has a plan to do it. You finish. I test country brand respiration science. In America when I was there, so you right from cornea to heart, liver, or the bones. So of metals, other issue much. That is another technology. Immunogenetics, we can, but in cadaver, sometimes blood group only. So that's the power of technology and available molecules to prevent rejection. Because that body has an immune system. With the derivative that in my body, remove that. So we have medicine. Therefore, we start lifestyle diseases and have for to prevent this kind we have activities not that once kind of a treatment to be available to them. So you can even see how those who are in Ghani, those who are not, you can see those who are not having it. They go much time. I've seen people. They try everything. But today, they have diagnosis is available. Tube is not functioning, ovary not functioning, and so on and so forth. They can make the ovum available and the sperm. In laboratory, they can fertilize and create the baby and put inside the uterus of the mother. Of the mother's uterus is not adequately absorbed. That's the power of technology and improvement in all sorts of medical care, right from baby to the geriatric person. We are very important nowadays. Universities, what do you do, including the physiotherapy and things like that? Samuel, physiotherapy is very much tell you causes problem. Diabetes affecting joints. Although we have joint replacement surgery, they are orthopedics. So many things are available to us, but still that is another big problem. Even in Japan, geriatric patients are more non-knowledgeable than younger people. Our country, we have younger people. That's a good thing, isn't it? Good thing. So next slide. I'll take 5 minutes more. We have to therefore improve our educational program. This is one slide, is very important. You must see how we can improve vertically and horizontally to bring together training program, particularly postgraduate and MBBS program and postgraduate. In AIMS, it was there, we followed right from beginning. See, every Tuesday, we have a combined round, combined clinical round, grand round, which include 2 departments will show some patient, interesting patient, which requires collaboration with radiology, laboratory medicine, so on and so forth. Ultimately, how we arrive at the diagnosis effectively and conclusively and evidence-based. For all the institution, clinician will come. And then clinical ground, one or 2 departments together who are linked to joint efforts to treat a particular patient which requires 2-3 departments together. Suppose lung problem is there or abdomen, liver problem, hematologists and pulmonologists together present their data. Much invite international method, Harvard or everywhere I have gone, that was practiced earlier. If it is and how you call various one CP clinical conference. Invite, say, because Sudhir is a very expert clinician. We invite and tell him this is a history, these are the diagnosis you have done, we give it to the diagnosis. Set you in is this abdeckly use all terrible diagnosis will be confidence. Till very people analyze whole institute, faculty, treating group come and listen to. Sometimes very experienced person, he pinpoint, well, yes, this will be the diagnosis. Very rare disease. Sometimes rare disease is present because difficult to diagnose sometimes. Next slide, please. These are, I have covered already. Blood transfusion is a big invention as a technology. You save millions of people. Millions of people in addition, RBC have told millions of people when a pregnant lady in anemic, we give blood transfusion. I'll mention here and robotic and various cardiac pacemaker and so on and so forth. I mentioned. Today I've read in the Hindu front page news, your Honorable Chief Minister, as I told you, he is giving a pulse polio molecule to babies. The program must continue. In the same front page, I have seen today's Hindu, you see how sad it is. One gentleman, he has seen in the internet, YouTube, how to deliver. Decided to deliver the baby of his wife at home himself. Can you believe? So much of ignorance, so much of misdirection, misguidance from the available knowledge. For whatever available knowledge you see in YouTube or anywhere, you have to be verified with a local person. So what happened? It happens. He had maybe is looked after by mother or somebody. But the wife had severe hemorrhage. Do you know what is this hemorrhage called? This is called postpartum hemorrhage. It is a very serious disease unless quickly blood transfusion and packing is done inside the uterus. The baby mother died most of the time. Therefore, pregnant lady needs to be monitored, and nobody should die like this. Whether it is by his husband, by her husband, they'll try to deliver. But even if it is delivered in an institution, they can save. Sometimes they need to, when upon a laparoscopic or upon the thing, ligate the artery supplying the uterus. Even that kind of drastic surgical intervention is required to save the postpartum hemorrhage afflicted lady. So that's the power of experience, power of knowledge, power of delivery of service with uses of technology in molecular pharmacy, so on and so forth. We therefore have to enrich our own experience, and if we make a mistake, we should not make next time same mistake, isn't it, Sudhirji? Yeah, that is called intelligent activity. If you keep doing same mistake, you are a foolish person. You have not learned from your own mistake. Therefore, your training program is required, CME and things like that. You require a faculty development program. Through faculty development, how to make a presentation, how to make a slide, how to present. New student coming from various background of language needs to be trained even to present. Younger faculty development program, there should be continuous. We have in AIMS right from beginning, we have a faculty develop unit, and that is being very successfully. Next slide, please. This I have mentioned already. Hemorrhagic dengue we have mentioned already. Next slide, please. So, medical nursing, dental, paramedical, everybody has to go through the finally quality improvement has to happen for excellent health delivery care practices, and in the medical education, including system development, available technology should be available. Smart room like this, as I understand today, this hall, when I came last time, it was different. Today you have a refurbished smart hall teaching faculty. In fact, my elder son works in a company which gives this kind of service to various organizations, including airport and institutions, higher education. So we have tremendous technology available, healthcare, medical care, communication. Telemedicine is another important thing. Through distant places, you can guide them and bring them person. Next slide, please. So I have already mentioned faculty development. It is very, very important. Even I, at this age, I still learn something. Wherever I go, I learn. Learning is a continuous process in life, be it medical or any higher education or a social learning. You must know how to greet a person on the road, or when you go to a bank, how to get the work done. So social behavior also very important nowadays. I have seen many people don't know how to be. They arrogant that I talk to a chokidar or a laboratory technician. We had in AIMS certain incident. One of the top doctor, he is highly punctual. Punctuality is very important. There is no doubt. But he found that when he is there working, he found that technical staff and all that, they are sleeping in their duty room. So because of his little arrogancy and kind of a he locked the people from behind, even not simply kundi lagana, he locked even, put a lock. So next day, there is a huge big strike by the worker. This man is mad, he is behaving with this. It was a hard time sometimes to manage organization also to different group of people. They should be carefully handled. They should be given incentive for their services. They should be, if not monetarily, sometimes give a bouquet, give a dress, things like that. We have to do like many things differently to retain the workers, not only the lower level worker, but also the give incentive to faculty members so that they don't go to in a lucrative job. They do even in AIMS there is exodus many people, but we have a structure. Lower people can take charge. Anyway, so next, I'll not go to. I have already mentioned that taxonomy. Today we need these two important things. Effective. We have to enter into the heart of the patient or the relative. Communicate properly, and psychomotor, motor activities are required. But knowledge is available. How to do it when you do surgery or do a interesting testing in a patient or a simulation surgery, you have to be very skillful and effective, skillful result, outcome-based activities. Without outcome-based, both in affective domain and the skill domain, patient, precise. These things I have done everything possible, face deteriorating. But if you say something is improving, next day is suddenly deteriorated, he died. Everybody will come with a anger and fight with the doctor and the relatives, particularly in casualty or outside ICUs. I have seen myself. I had to come from home sometime as a director or a dean to pacify the relatives and even institution like AIMS, because they are also, there are certain people who are not as efficient or as good. Mistake occurs in communicating. Communication is very important. Dr. Sudhir has told me human and humble and effectiveness and trustworthy. You have to build a trust between the partners. Means that you are service partner. You are giving service to patient, society. Society has to trust you. No, this is to be all our 1 year to build trust like that. I can boast, I can tell you confidently and factually that AIMS have made such kind of trust in the public and the government. Government matters. Government gives money to government institution. So, we created 6 more AIMS, of which I was directly as the mentor for those 6. Are doing fully. Looking at state government now create total 23 AIMS. It is public and also public funding given to institute as a model. Lani was fully funded grant that I have told. But currently government is asking to fund and from bank that model and sit 10 we have special if particle they but you to understand the quality care to feel funding is big and support you can see how easy technology has changed in cardio. I'll tell you one example, simple. Maker has made a proof from epidemial maker begin with 2 important is the technology next slide please. And this I was in to segment technology has evidence for medical human projected all level molecular personal. That's the technology treat quality of life and hospitals people are benefit from available and for the cause of electricity impact in the lives of the society this and the country and the best is thank you so much.
Thanks for the invitation. For rest precision, we will now proceed with the presentation of session. May I request the dignitary to occupy seats? The Honorable President VMRF, the citation, honor the distinguished orator Chandra. Please join him. Congratulations, sir. Thank you, sir. To deliver vote of.
It's my say Shanmugasundaram Endowment Oration. The first act of the word and when I was his presence. Thanks. I had the college member of UGC Tradition Advisory Council Ethics Committee. The former director he is accepting our chairman's founder chancellor's oration, Dr. A, and he gives outstanding rating. Sir, they are out for all this advisors. We will take a sir. We will man our National Research Foundation. Thank you so much. Thanks for one again. Thank you. The Vinaya Mission Research Foundation, the Vice Chancellor, the Vinaya Professor Dr. Savadan and even entire to Professor Dr. Amir this creation Shanmugasundaram Endowment Oration and the Vinaya Mission Research Foundation, the senior officials of Vinaya Research Funds, all the head of the institutions, principals, faculties, head more than that, students, and so staff. To all become.
Thank you. Like the get to guide for the
चल जलधि तरंगा शुभ नामे शुभ आशीष मांगे आहे अब जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय 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 हे.
Thank you. On behalf of VMR of DU, we once again thank all the dignitaries, faculty members, and students. We request the gathering to have the refreshments being served outside the auditorium. Thank you all.
ஆனா சிவா நான் மேலே இருக்காரு. என்ன பண்ற ஆபரேஷன்மா? டிவி ஆஃப் பண்ணு.